Good evening. Good evening and welcome to the Spotlight Tampa Bay Family Caregiving Forum, presented by AARP Florida. I'm Conan Gallaty. I'm the CEO and Chairman of the Tampa Bay Times, and we are truly honored to have you here with us tonight for this very important community conversation. Spotlight Tampa Bay is an initiative that we proudly launched last year aimed at bringing together thought leaders, experts, and stakeholders to engage in meaningful conversation around the issues that shape our community, our region, and our state. Tonight, the focus is on family caregiving, an issue that touches the lives of more than 2.7 million Floridians. We have an amazing panel with us of experts that I'll introduce here in a moment, but first I would like to introduce you to Jeff Johnson, the Florida State Director for AARP. AARP has been active in the Tampa Bay community since its founding in 1958, and Jeff and his team of volunteers and staff have been advocating for older Floridians at the national, state, and local levels, with a particular focus on supporting family caregivers for decades. We're excited to partner with AARP to make this evening's conversation a reality. Please help me welcome Jeff Johnson.
Thank you, Conan. And on behalf of AARP, I just want to give my appreciation to the Tampa Bay Times for hosting this really important forum and for this distinguished panel that'll be having this conversation here tonight. Family caregiving, as Conan said, is something that we find at AARP affects so many of our members. We have 2.7, 2.8 million members in Florida, and there are 2.7 million caregivers here in the state of Florida, many of whom have given up jobs or cut back on work, others who are giving of the resources that they have, on average $7,000 or more per year to help support the people they love. And many people don't even think of themselves as family caregivers. They think of themselves as being a good daughter or a good spouse or a good friend. And I think it's important for us to acknowledge that caregiving is an issue that we can deal with not only as individuals, not only as families and in communities, but from a policy perspective as well. We may live life as individuals or as families, but our policies, our procedures, our programs, our culture can make living easier or can make living harder. And so having tonight to talk about what we can do to help support family caregivers is incredibly important to AARP. I appreciate those of you who braved the weather to be here tonight, as well as those who are watching the video. We're looking forward to a great conversation, and now I will turn it over to start this conversation with Tampa Bay Times Business and Health Editor Justine Griffin. So everyone, please give our panel of experts a warm welcome, and let's begin.
Thank you, Jeff. Thank you, Conan. And thank you to everybody for braving the rain to be here tonight. We really appreciate it. And I'm very excited to introduce our expert panelists tonight. But before we do, caregiving is a topic that I think clearly affects everybody in this room. I've been thinking a lot about it in advance of this event, thinking about how my parents cared for my grandparents, close friends cared for their siblings. It's something that is so deeply personal and touches so many of us. We've thrown this 2.7 million figure around of Floridians who are caring for their loved ones right now. And we hope to dive deeper into what that means in terms of policy, financial burden, mental health burden, and more tonight. So without further ado, I'm going to introduce our panelists tonight. Right here to my left is U.S. Representative Kathy Castor from Florida's 14th Congressional District. And then we have Keith Gibson, who is the Director of Diversity, Equity, and Inclusion at the Alzheimer's Association. Noemi Cruz, the Senior Director of Healthcare Services at Florida Blue. Rhonda Richards, the Government Affairs Director of Family and Caregiving at AARP. And Amanda Singleton, an attorney at Singleton Legal PLLC, and she's also an AARP family caregiving expert. So toward the end of this hour, we will be taking questions from you, our audience. We'll be passing around cards for you to write those questions down, and some folks will be coming through to take those. So please, we're happy to answer as many questions as we can. But to start, we've already touched on there are 2.7 million Floridians who are caring for aging parents or older adults in their family, and millions more who are caring for young children or adults with disabilities today. Across the country, that figure balloons to 48 million caregivers. Rhonda, I was hoping you could take this first question of, do you expect that number to continue to grow? And if so, why?
Well, thank you very much, and thank you for everybody coming tonight. This is an issue that impacts everybody. Everybody either has been, is, or will be a caregiver, or will need the help of one at some point. And Rosalind Carter has a famous quote actually right along those lines. So the need with the aging population and people with disabilities living longer, there is going to be a need for more family caregivers. The number may not necessarily keep up with the need, which is all the more reason and why it's all the more important that we do what we can now and going forward and all the time to support our family caregivers, because they help people live independently in their homes and communities where they want to be. And we need to support them and help them address the challenges they face, whether they be physical, emotional, or financial, because this is an issue that impacts everyone at some point.
Keith, through your organization, I'm wondering if you're seeing the number of caregivers grow as well.
Absolutely. Caregivers are the cornerstone of our communities. And in my many roles with the association, I also man our helpline. So it's not a day that doesn't go by that I'm speaking to a caregiver who is in the midst of the battle. And so this number will continue to keep growing, and we need to really make sure that we support them, because again, like I said earlier, our caregivers are the cornerstone of our community. And I speak from experience because I was a caregiver myself. I cared for my brother who died at age 54 with vascular dementia. It was not something that I had planned for, but it was my call to duty. And so I have the distinction of being a caregiver for my siblings as well as for my parents. And so to your question, Justine, yes, this number will continue to keep growing.
And I think the cost of caregiving will continue to keep growing then. AARP has lots of data points about caregiving, and the average caregiver in the US spends upward of $7,000 in out-of-pocket costs. Nationally, that figure equates to $600 billion of unpaid care for loved ones. That's huge. Naomi, can you expand on what sort of relief is out there for caregivers who are dealing with that financial burden?
Sure. So it's interesting that you say that, because I think there's also an impact to income, loss of income, an inability to save for when something is needed. So the impact is out of pocket and inability also to just have a savings. At Florida Blue, one of the things that we're supporting our caregivers with is through our Florida Blue centers. We have our social workers who work with community members, not just our Florida Blue members, but help our members connect with resources in the community. Our social workers and nurses not only work in the centers, but also work within the communities for multiple community events, vaccination events, screening events, and they can help either through a call that someone may want to reach out to them, or by visiting one of our Florida Blue centers here locally. The other thing that I also wanted to mention from a Florida Blue side, our employee base, one of the things our company has done is to extend a caregiver benefit to our employees. So besides your 12-week FMLA, that's something that everyone has as part of an act. Our Florida Blue GuideWell company has offered a 2-week additional benefit to our employees that's also paid. And because we understand that that's just, we recognize that within our company, we have a large women workforce, and it's something that we need to continue to support.
Does anyone else have relief ideas or things that you're seeing in practice that are helping people? Rhonda?
Well, in terms of financial relief, that's really something that's critical to provide family caregivers. You heard about the $7,200 a year on average in out-of-pocket spending for family caregivers. That also equates to about 26% of income on average, which is quite significant if you think about it. ARP has been advocating at the federal level for a couple different ways to provide caregivers with financial relief. One is a bill called the Credit for Caring Act, which is a tax credit of up to $5,000 for eligible working family caregivers to help offset a portion of a cost of things like a home care aid or respite care or home modifications or assistive technology or other things that help the loved one stay at home, just an array of different things. We also have endorsed a bill called the Lowering Costs for Caregivers Act, so that if you're a family caregiver and you have a health savings account, a flexible spending account, an Archer medical savings account, or a health reimbursement account, that you could use funds in those accounts to pay for qualified medical expenses for a parent or parent-in-law. So those are two examples of federal legislation that could help provide some financial relief for family caregivers.
So Kathy, we've seen in a few other states like Michigan and Oklahoma, there's been legislation passed that also provide tax credits at the state level. What would it take to see similar legislation like that passed in Florida?
In Florida, let's face it, Florida's tough sledding oftentimes, but what we can do from the federal level is to provide a lot of those resources directly to families, right back into their pocket, as Rhonda mentioned, a federal tax credit on your federal taxes. But I really want to thank all of the caregivers who are here and all of the partners across this community. The Tampa Bay area, we are a loving and kind community, and we look out for each other. We care for our neighbors, but boy, folks are being squeezed right now. There's so many that are in the sandwich generation, looking out for kids, taking care of older parents, or the family with a child with special needs, or the aging spouse, and oftentimes people are isolated, they don't know where to turn, and we're fortunate to live in a community where there are resources and nonprofits and community-based services, and a lot of the folks here that can connect people. I think part of the challenge is knowing where to turn right now. But to give you a little bit of hope on making progress, the AARP a few years ago came to me and said, we're looking for some bipartisan solutions at the federal level to get additional resources down to caregivers. And they asked me to co-sponsor the RAISE Act, the RAISE Caregivers Act, and Rhonda was instrumental in this, and Jeff Johnson and everyone, the AARP. It passed in 2018. It required all of the federal agencies to get together and to inventory the help that's available for neighbors across America, and then to make recommendations. They appointed an advisory council, and they came out recently with an inventory of initiatives and then a strategy with recommendations for real help. Part of that is the tax credit. Part of it is what's working right now in Medicare on home health that can help families. Obviously, we need to do a better job of keeping folks in the home cared for. That means caregivers need additional respite care. What's working is at the VA, at Haley Hospital and Bay Pines. Some of the best caregiving initiatives come out of the VA. Just a telephone line to pick up and get help. Actual respite care where people can turn. A lot of those initiatives for our veterans can be replicated for the larger population, and it can help us save money. It's very expensive to have a loved one in skilled nursing. The longer you can keep them at home and take care of the family caregiver, make sure they're healthy and well and not making tremendous financial sacrifices at the same time. That makes sense for the bottom line of families and for the federal budget too.
I'd just like to add something too, that the Alzheimer's Association is definitely committed to the caregivers. Matter of fact, every year the Alzheimer's Association publishes a report called the Facts and Figures. This year we had a special report that was focusing more on dementia care navigation, and it highlighted a new program model called GUIDE, which is Guide and Improving the Dementia Experience. And this is a model that's being promoted by CMS, which is the Centers for Medicare and Medicaid, because we realize that being a caregiver and trying to navigate the system is like a maze. So what this model will do is give a standardized approach that's going to be supported by a dementia care team. So that way it's like a one-stop shopping. So I'm very, very excited about the fact that we're getting the support from our federal government to realize that it's important that we support our caregivers and make this journey as less complicated as possible.
Great points. Rhonda, I wanted to circle back on the Credit for Caring Act. In January, that was reintroduced to Congress, and that's where you mentioned the $5,000 tax credit for caregivers. Where does this legislation stand? Has it passed?
It hasn't passed at this time. We've been working and building support, bipartisan co-sponsors in the House and Senate. Next year, Congress is going to be considering tax legislation because there are certain tax policies from 2017 that will come up, and if Congress doesn't take action, they will stop, and if Congress, they can modify, they can change, they can continue, they can stop, they can do any number of things. But that's an opportunity for things like the Credit for Caring Act to be considered. So we've been working to build support and visibility and educate policymakers in Congress about why Congress needs to provide financial relief to family caregivers, and that's something that we'll definitely be focused on as we look toward next year, because this is the time to do it. It's very important. It impacts a lot of people, and we've been working to raise the visibility on that and engage more members of Congress on the need to do that.
So Kathy, I have another one for you, specifically about Medicaid. From Governor Rick Scott to Governor Ron DeSantis, Florida has a track record of passing on Medicaid expansion. In the short term, at least, Medicaid can provide some services for adult care for those who qualify. Do you think Medicaid expansion is a viable option for Florida, and what would that take?
Justine, I am so glad you asked this. Florida is one of just a handful of states that is not bringing our tax money back home. When we passed the Affordable Care Act that eliminated discrimination for pre-existing conditions and allowed children to stay on parents' plans to age 26 and help close the donut hole, it also provided states with big incentives to make sure that everyone has access to affordable health care. If you're a working class person, you don't have health insurance, the feds now will pick up most of the tab of seeing the doctor or getting the care that you need. But the state has to agree, and they have to put up a small matching percentage. And this is financially, it's financially detrimental to everyone in our state, and it's morally wrong not to take those dollars, because those dollars could be plowed into additional care. If you think about, if you're not quite at Medicare age, you've worked hard all your life, maybe you've worked outside, and your body is broken down, and you have ailments that are getting worse. What could be worse than having to try to just go clinic to clinic and not get continuity of care, real care, so that you can stay healthy and well and not be a burden on your family? And so I would hope that this dialogue will lead to ways for all of us to come together to advocate to improve people's lives. One of the ways to do that is, I think, through the tax credit for caregivers. Another way in this state is to expand Medicaid and bring our billions of dollars home to work for us rather than sending them to other states.
Naomi, you mentioned the Florida Blue Centers and many of the resources there available to Florida Blue clients. Can you talk a little bit more about what other resources are offered by private insurance that maybe Florida Blue has found a need for that would apply to caregivers?
Sure. So in the Florida Blue Centers, it's not just our members, our Florida Blue members that can utilize the center. It can be the community as a whole that can walk in and get support as well. One of the things that in the Medicare space we've been doing is we offer today a digital app and service, not only digital, but also through a call-in number so that our Medicare members can get support for respite care. So that's something that we're looking at. We also have other digital tools. We're always looking for opportunities to look at what other care partners can we partner with around resiliency and building more programs in the community. Our Florida Blue Centers are very hyper-focused and very locally focused. They want to understand, are the needs based around nutrition, physical activity, do we need an understanding on just organization and what are things, our communities that can help. So our social workers do first an assessment. We also have our nurses. They first do an assessment and they try and understand what are the gaps that the member has or the community member is searching for. In a lot of cases, community members don't even know that they are a caregiver. They don't identify as one because they're just taking care of a family member. And some of that is also talking to them about here are some services in the community that can help you and can connect you and can help pay for care and also can help get care.
Great, thank you. So Amanda, when we were talking before the event started, something that Naomi, you just brought up I thought was really important to mention again is that there are so many of us who take on a caregiving role to a family member or a loved one, and we just do it because we love them, right? We don't see it as this new role that is expanding into our busy lives, right? It's your mom. You're going to help her, right? You're going to find a way to fit that in, but without understanding the burden that comes to you yourself as this newly minted caregiver. I was wondering if you could share a little about your personal experience being a caregiver and how that's maybe helped you through the work you're doing as an attorney.
Sure. So I became a caregiver at the age of 30, and it was very sudden. In the following years, my husband and I lost 3 of 4 parents and a sibling, and my husband was incapacitated 2 times and bedbound, and that all happened in less than a decade. So my caregiving life began very suddenly with my mom. A lot of people don't identify as a caregiver for a while into the journey because they're just picking up things around to help, to, maybe check the bills, pick up groceries, things like that. And for me, my 60-year-old mother was diagnosed with brain tumors and had a craniotomy that day. And so by that night, I knew that her prognosis would be very poor because that's what the neurosurgeon said, and that she wasn't expected to live for weeks. And so that was the moment that I said, well, I'll take care of her the best way that I can in return for her taking such good care of me. And she didn't live for weeks, she lived for 1 year and 3 days. But during that time, it was very difficult to maintain a 24-hour-a-day caregiving role and my job. And we were right in that gap. We were a little too young. Like I said, my mom was 60, I was 30. There weren't a lot of resources for us. And I didn't have the knowledge base because what 30-year-old plans for that? It's just not a part of life. You're getting married, you're working. We had just bought a house, my husband and I. That's where my mind frame was. And so I was thrust very suddenly into the world of caregiving and then lived there for many years after. For me, it completely derailed my life, but it gave me a whole new one. because now I get to advocate for family caregivers. I had the dream of becoming the type of lawyer that I needed at the time when I caregave for my mom, and so I did. And I'm very fortunate for that. But, you know, dovetailing off the conversation, the two things that I identify as a sudden and constant caregiver over a long period of time now is that caregivers need information, they need resources. It's too hard when you're in the process of it to find it yourself. It's reinventing the wheel. The information needs to come to you. You need to be trained by medical providers for what to do when you come home from the hospital. You need to have access to respite care because one person cannot caregive 24 hours a day and keep all the other balls of their life up in the air. It is just too hard. Caregivers can do anything, but they can't do everything, is something my friend Amy Goyer from AARP always says. And it's true. It just leads to burnout. So the gift of time through respite care and the gift of being able to maintain employment if they know that they need to have a job, and most people need to have a job. We were talking about the costs of caregiving earlier. People now need $11,500 more a year than they needed in 2021 just to maintain the same standard of living. And then if you add in the extra out-of-pocket costs of caregiving, and a lot of us take care of more than one person at a time, so it's $7,000, and then you multiply it. People need to remain in their jobs and work. So in my personal and professional life, I feel strongly that the resources that we need to give to people are information, grants, tax credits, paid leave, and really the gift of time to spend with their loved ones while they have them.
Keith, you also had some really great points to share before the event started about access to this kind of information of where to find resources when you're thrust into this caregiver role. I was hoping you could talk more about what you do with your association from support groups and how you reach diverse communities to make sure everyone has access to the same resources.
Well, we are very fortunate here in Florida to have these two amazing mobile units that allows for us to go into our rural communities, because Florida has 67 counties, and majority of them are rural areas. So people are not going to be able to have access to information. And in my space of the DE&I world, it's not just Black, Hispanic, LGBTQ+, it's rural communities. We're talking about those communities that are disproportionately affected, underrepresented, underserved, and under-resourced. So having these two mobile units allows for us to bring information into the communities so that way we can educate them about early detection, early diagnosis, brain health, risk reduction, and accessing resources like support groups, which are so important. A lot of times people think of a support group, oh, they just simply complain. No, that's not the case. With support groups, you have caregivers that are sharing their experience and they're helping one another out so that they don't have to go through this journey by themselves. And if I can give you the most important resource that we have readily available, that's our 1-800 number, which is 1-800-272-3900. That's 1-800-272-3900. That is our helpline, which is staffed by master-level clinicians that are available 24 hours a day, 7 days a week. So no matter what hour of the day or night that you call, you will get a live person. How do I know? Because in times when I'm having difficulty sleeping, I will call our helpline and just to simply say, hey, thank you for your service. And because they are an amazing resource, and they help you, as well as caregivers, as well as the person that's living with the disease, feel like they're not alone. And this is such an amazing time because we used to have this feeling of hope is on the horizon. Well, hope is here right now. And so resources are readily available. So, and like I say, I have the greatest job in the world because I can be able to share my experience as a caregiver. And because I've walked a mile in those moccasins, and I know how frustrating it could be when you feel like you're all alone. But you're not alone, because the Alzheimer's Association is truly committed to the caregiver, and we look at the caregiver as a true investment.
Great. So Rhonda, we've talked about federal legislation, Medicaid, private insurance, but what we haven't talked about yet is Medicare. Medicare can cover some of the costs of home health services, mostly in the short term, but what conversations are happening to possibly bring more coverage through Medicare?
Well, I actually have some good news. Medicare's been actually doing some things to help family caregivers. One of the things is the guide model that Keith mentioned. From day one, there was actually support for family caregivers as part of that model. Respite care, education, training, things like that were part of the guide model from day one, and that was something that ARP advocated for as well. In Medicare now, started January 1, 2024, Medicare covers caregiver training services. It pays healthcare professionals solely and specifically to actually train family caregivers in things like daily activities, like if you're trying to help someone bathe and how do you safely transfer, move someone from like chair to bed, vice versa, sort of eating, daily activities, behavior management and modification training, like if you're helping someone with Alzheimer's or someone who has some mental health challenges, for example. And Medicare recently proposed to make these services available via telehealth next year. That's not final yet, but that could help expand access for caregivers who might not be able to be as easily in person to get these training services. Medicare also proposed to expand these caregiver training services to pay healthcare providers to train family caregivers in more of the medical nursing tasks kinds of things. So if you need help with infection control or wound care or other different things like that, Medicare would help pay healthcare professionals to show you how to do that. There is absolutely more that Medicare can do as well, and we've been advocating with the Centers for Medicare and Medicaid Services, which administers Medicare, to help support family caregivers in some of the ways I just talked about. Also at discharge, like when you're coming home from the hospital and things like that. Better identifying family caregivers, making sure that they're appropriately included in care, that you're looking at their care experiences. So there's a number of things that Medicare can do. Those are some administrative things that can be done without an act of Congress, but we're also advocating for things that Congress could do in the Medicare space. There's a bipartisan bill called the Alleviating Barriers for Caregivers Act, and that's about reducing red tape for family caregivers. We've heard talk about time and like the challenges of finding resources and navigating complex programs and paperwork and forms and red tape and all of that. This would have the Social Security Administration and Medicare and Medicaid look at how they could reduce red tape for family caregivers, looking at forms and processes and procedures and all of those kinds of things, and seeing where are there opportunities to make it easier for family caregivers to help their loved ones. And then there's another bill called the Connecting Caregivers to Medicare Act, because you might have heard of 1-800-MEDICARE. If you've had Medicare, you can call that. It's a 24/7 hotline to get information. And sometimes family caregivers may be calling that if you're helping someone with Medicare. But there's actually, if you have Medicare, you can fill out a form if you have Medicare to give 1-800-MEDICARE permission to share your health information with a family caregiver or someone you designate, so that if that family caregiver is calling 1-800-MEDICARE and advocating on your behalf or trying to help you figure out appeals or benefits or coverage or whatever it may be, that it makes it easier for them to talk to 1-800-MEDICARE. That's a choice, and people can make that one way or the other. But that bill would help make sure that more people are aware of that option, so that they know, and it can be easier potentially for family caregivers to help navigate Medicare on behalf of their loved one and support them. So those are some things in the Medicare space, but Medicare is really important because other people look to what Medicare does and sometimes follow what Medicare does. So that's an area that we've been focusing on a lot because it serves a lot of people, and a lot of people on Medicare have family caregivers.
So Rhonda, is there a difference between all of that, the improvements in Medicare, and then what's happening in Medicare Advantage?
In Medicare Advantage, there are some There are policies in Medicare Advantage. Sometimes there are what's called supplemental benefits, and plans can offer certain benefits that might help support family caregivers like respite or some home care options and things like that. In Medicare Advantage, plans can change benefits and things like that each year, and they decide what they offer and who is eligible and things like that. So there are ways to support family caregivers in Medicare Advantage as well. Those can change from year to year and whatnot as well. And it's important to support family caregivers across people with Medicare, whether you're in traditional Medicare, whether you're in Medicare Advantage, regardless, caregivers need support in general. So we need to make sure that there's policies in place in Medicare, in Medicaid, broadly to support family caregivers, full stop.
All right. So Kathy, in my years as a reporter covering healthcare, one of the most frequent phone calls I received from readers were often caregivers struggling to find information and resources and just struggling to, I think, get the point across that it can be an incredibly hard journey being a caregiver and finding the support that they need. Do you feel like lawmakers see this? Do you feel like they understand the plight of today's caregiver? And what can the average Floridian do to really ensure that policymakers are hearing them?
Yeah, it is so complicated on just how you receive information these days and how you access it, especially if you're a caregiver that you're focused on just trying to get through the day and you don't have time and where do you turn. And I think it is incumbent upon all of us to develop some better solutions. I think Medicare should be more proactive on this, so that's good to hear that these kind of improvements that we've encouraged, they're happening. I think in the Medicare Advantage space, I'm a little concerned that sometimes policymakers don't have the same heft in accountability. If something happens in traditional Medicare, we can harangue CMS and try to get some answers, but for some of those private plans, it's much more difficult. I'm very worried about that. The prior authorization that a lot of the Medicare Advantage plans require from doctors is not as easy as traditional Medicare. But talking with folks beforehand, you have to provide these resources in all sorts of different ways, through the newspaper, good newspaper coverage, through the Latin community. We were joking that maybe on TV and their telenovelas, that's how they get information. There's some very creative people here that are doing it through plays. Sages was here. The Center for Women, I saw Susan McIntyre. She is bringing people together, maybe what did you say, Susan, through an art class that you knew that these older women were a little more isolated, and then broaching the subject on caregiving and respite that way. And I think it's important to have just a myriad of outreach under a common umbrella that we have to do more to support our caregivers.
Go right ahead. One thing. I think another important thing is we've talked about how this is an issue that impacts everyone. It impacts lawmakers too. Some of the biggest champions in Congress and in states, legislatures across the country, are people who are family caregivers themselves, or they've seen this in their family. They get it, they see it, they understand it. They may hear about it from their constituents who share their stories when they go in and meet with their members of Congress, or they write them letters or emails or whatever the case may be. So I think also the experience of being a family caregiver or seeing it up close and personal also informs and shines a spotlight and shows people the need to support family caregivers and the challenges that they face.
I'd like to also jump in here as well. First and foremost, the Alzheimer's Association is very appreciative of Congresswoman Kathy Castor and all of her support and our legislative priorities that we've done. We are advocating, we go to Washington, D.C. and to Tallahassee to let our legislators know that there are things that need to be done, and we bring with us our caregivers so that they can hear it from the horse's mouth. Because we have to walk these halls and let them know that we are a voice that will not go away. And so we see this as an opportunity. And so I'm super proud of the work that we have done in terms of advocating on state and federal level to bring about necessary changes and to keep this conversation and dialogue going.
You're right, you are not shy. You are not, the Alzheimer's Association, AARP are incredible advocates, and it is very impactful when people are talking from personal experience and they're your neighbor and they make it real, and that there's nothing more important for a policymaker.
Amanda, what kind of cultural shifts do you feel like are needed in this country to find a more meaningful way to support families caring for their loved ones?
Well, I think the good news is how much has already happened. You know, in the last 15 years, the visibility of caregivers has just exploded, and that's a wonderful thing. I heard years ago at a caregiving conference someone say, caregiving is the new cancer. Back in my day, people didn't talk about cancer. They just got it, and they just dealt with it. And that's the same way people have been doing caregiving. Stiff upper lip, don't talk about it, get the job done. And meanwhile, they're burning out, they're crumbling, and they don't reach out for help. And in the last 15 years, caregiving is in the conversation. Has it become perfect? No, because we're at a point where it's going to be 3 people who need care for every 1 person who's going to be able to care for them. It's unsustainable, and a lot of us will be taking care of multiple generations at a time. It's quite a lot. So the cultural shifts that need to happen, that are already happening, is that we are talking about it. You all are here tonight. Thank you for being here. You know, there are law changes happening. Private companies are picking up where the law is not meeting the need. I talked about paid family leave a minute ago. I think it's one of the most important things that need to happen to keep all of those caregivers who are providing care to the 3 people. They're going to need to work still. But in the absence of paid leave, companies are stepping in. Employers are providing caregiver supportive services, giving options to people so that they can keep working, but also take care of their people at home. They don't need to hide the fact that they have a life to keep their job. And that's what has happened traditionally. A lot of people don't even tell their supervisor, like, this is what's going on at home, because they don't want to be retaliated against, they don't want to be let go or passed over for a promotion or whatever it is. And that's shifting. And I think the most important cultural shift that really needs to happen is keeping the visibility, keeping it in the conversation. I say to people, you plan for everything else. You plan for retirement, you plan to buy an RV, you know, you plan to have a baby or buy a house or buy a place in Florida, you know, things like that. Those are things people think about planning for, but they don't think about planning for caregiving, and I don't understand why. Because it's going to come calling for all of us. So I really feel like in the Adult 101 class, when you're 18 years old, all right, what's going to happen if people in your circles need you? How is that going to look? Have you done your planning, your legal planning? Has your family done your legal planning? Because as an attorney, I'll tell you, most people don't. 90% of people say it's important, but only 37% of people actually do their legal documents. And then, if they have a medical emergency in their family, they're already starting at a deficit because they don't have what they need to caregive with good effect. And it becomes more expensive and more time-consuming and more burdensome to jump in and get things done. So I think that the biggest thing that needs to happen is people accept that this is going to be a part of their lives and plan for it.
Go right ahead.
I'd just like to jump in here, Justine, if I will. When you talk about cultural shifts, as one of our pillars for diversity and inclusion, the Alzheimer's Association is making sure that there's open access for all communities. And we are really super proud of the fact that there is the intellectually developmentally disabled community that is in need of having access, because if you're not aware, in that community, individuals that have Down syndrome are at a higher risk for developing Alzheimer's. And so we here in Florida and particularly around the country are really focusing on making sure that there are the resources that are readily available, particularly for that community, because when you're seeing that that you have a loved one that has Down syndrome and they're aging in place and now they're starting to develop mild cognitive impairment, there needs to be resources to identify those signs as well as what's going to happen when they're aging and they can no longer stay at home. Well, there's not that many options available for them, so we need to fix that. And so to be on the pulse of what's happening culturally in that shift, the Alzheimer's Association is definitely committed to making sure all communities have the access.
I wanted to just thank Amanda for her comments because I thought they were great. And I think we've seen some of the things that Florida Blue too from an employer perspective, which has been so great. We have seen some of those cultural shifts happen within our organization as well. One of the things that made me think about this was recently our organization created an employee resource group. So in a group where employees can come together to talk about caregiving and the struggles with caregiving. And we have had by far a resounding need for that. And the largest group has come together to talk about the struggles around taking care of family members. And so I've just appreciated that culture shift, if you will. And I think we've always had a really great culture. I love working for Florida Blue. But to see that in the past year, that we had about 600 employees right away join up from the onset of this resource group come together. And we've given it the name of Care Well, and we've created a space where people can come together and talk about what it is to take care of a family member, and also to share resources and talk about what it means to care for yourself as well. Because I think that's something that, Amanda, you were alluding to, which is it's so important to, and it's very hard to do. I'm a caregiver as well. My dad has had Parkinson's now for about 5 years. He's in his 80s. He's progressing pretty quickly. And my father-in-law has Alzheimer's. So we've struggled with just taking care of ourselves, making sure that my mom is taking care of herself, that my mother-in-law is taking care of herself. And I support them as much as I can. I think having that family unit or people that can help you and identifying those folks has been important for me and my family. And I just think that making sure that you take care of yourself first, it's so hard to do, right? But to really think about taking care of yourself first is really, really critical. It's almost like I always say, it's like getting on a plane where they tell you, hey, put on your mask first, and then put on the mask for your children. It's kind of that same storyline where you have to really make sure, and again, hard to do, make sure that you're taking care of yourself, and that means make sure you're getting your checkups annually, make sure that you're getting with your doctor, make sure that you're taking care of your personal family, and making sure that you're also connecting from a work-life balance.
And I would just add, I think these are all excellent comments, that also the universality of it, we're all in this, and it's gonna impact all of us. So people aren't alone in experiencing this, and it's okay to ask for help. RAISE also stands for recognize, so we need to acknowledge that caregivers are, there and talk about it and share stories. Assist, include, support, and engage. And so it's important that we include caregivers, whether in healthcare settings or other settings or in those difficult to have conversations that are important to have in families, and policymakers, and make sure that resources are available, whether it's AARP's Caregiving Resource Center at aarp.org/caregiving, or many other resources. But I would also just note that more than 7 in 10 voters 18 and older say that they would be more likely to support a candidate who backed proposals to support family caregivers, such as paid leave, a tax credit of up to $5,000, and expanded access to support and respite services. So it's an issue that voters care about as well.
So we have lots of questions from the audience. Thank you, everyone who took the time to write these down. We're going to try to get through as many as we can before we run out of time here. Let's see here. This is a great question for you, Amanda. Do I need any legal power caring for an adult daughter living with me who has no assets in case she needs a nursing home placement?
100%. So I would strongly recommend that you make an appointment with a qualified attorney. There are a few resources you can use to find one. You can contact AFELA, which is the Florida chapter of the National Academy of Elder Law Attorneys. Despite its name, elder law attorneys do not just deal with older adults, people over the age of 65. They deal with people across the lifespan with a variety of conditions. So I would recommend starting there. If you need to find an attorney who practices in that area, they do have a member directory. It is so important to do that kind of planning, and you may be surprised at some of the things that are out there that are available to you. And it's not just planning for your daughter, it's planning for yourself, because you need to make sure that your daughter has people on deck to help her in the event that you cannot, in the event of your own incapacity or passing away, and ensuring that whatever she may inherit from you, if you own a home, if you have a car, if you have a checking account, those are all assets that maybe it would not be beneficial for your daughter to inherit directly if she's receiving programs and services. So there's so much that goes into it, and getting the information, meeting with someone qualified to talk about it will be extremely helpful. If budget is a factor, I recommend reaching out to the 13th Judicial Circuit Elder Care Center. That's in Hillsborough County. They may be able to point you to a low or pro bono attorney who can assist you, as well as Bay Area Legal Services, Gulf Coast Legal Services, depending on what county you live in, and they may be able to guide you. But yes, I do absolutely recommend to begin planning ASAP. AFELA, AFAELA, Academy of Florida Elder Law Attorneys. Sure.
Rhonda, this one's for you. How do we arrive at the 2.7 million figure of Floridian caregivers? And how or when was that figure obtained? Is it current?
So that figure is from a study that ARP's Public Policy Institute put out in March of 2023. It's a study that looks at sort of caregivers nationally and then does a state-by-state breakdown. And it looks sort of at a certain definition of family caregivers and puts a dollar amount on the value of care they provide and things like that. But if you, it's arp.org/valuing. There's a one-pager that has all the state data on it. There's the report itself, and then there's also some methodology that goes into the detail about how the calculations were arrived at and whatnot, if you would like to do a deeper dive on the data.
All right, Keith, I think you can take this one. As a former decade-plus caregiver and a 3-time USF grad trying to re-enter the workforce, I'm finding that my employment gap due to caregiving is looked at negatively. Can you speak to this issue?
In terms of that, that's actually a plus, because when you look at long-term care organizations, they look for that expertise. It depends on where you are looking to find that career opportunity. So as a caregiver, you have that's a skill set that's working for your benefit. So there's various organizations that will definitely look to help you with that.
Anyone else have any advice for that?
I think it may be something that actually you bond with a potential employer or supervisor over, because you never know who else has been a family caregiver themselves. So if you explain the situation and things like that, and it obviously can be hard to do, but if someone may have been in your shoes themselves, or may know someone and may experience that too. And sometimes policy changes with employers in terms of support for caregivers and resources and things like that happen because people in leadership experience this themselves, and they realize, if this is me, this could be happening to a lot of my employees and things as well. It also points to policy in terms of, preventing sort of, caregiver discrimination and that kind of thing based on your status as a caregiver.
I'll jump in on that too. CEOs are now being trained to share their caregiving experiences with their employees because they need to show that this is part of life. And when people are doing resumes now, they're being told, list being a caregiver, put those years down, because don't make a mistake to think that caregiving is not work. Caregiving is one of the hardest jobs in the world. And the skills that you obtain doing it are valuable. When they say caregivers contribute $600 billion to the economy, that's labor. And it should be on your resume. It should be listed and, sourced with pride, because a lot of people don't want to step away from the workforce. They have no choice but to take a limited position or step away entirely for a period of time. And that should not be a ding. That should be an asset, absolutely.
I just want to add to, also too, when you think about it, particularly one industry, your home health agencies, they hire private duty caregivers. And again, never minimize those skill sets. You want to list it out, because again, that's a career path that you didn't plan for, but you know what? It is a skill set. So definitely you are employable, even because you need to recognize that you are a private duty caregiver. And that's one of the things that, unfortunately, a lot of caregivers don't self-identify as a caregiver. And therefore, they minimize and they miss out on opportunities and resources. So if you're a caregiver, that is a skill set, and that is something that you definitely want to list on your resume.
Amanda, I think you can tackle this one too. As a social worker in this community, I come across older people with no family or support who are no longer able to care for themselves. How does this community address guardianship for these individuals?
There are a lot of people who are considered solo agers at this point. That number is going to increase. The people are having what are called gray divorces, and there are a lot of people who have remained single by choice in generations, so that is a factor. Addressing guardianship for these people, guardianship should be the last resort. People should plan for themselves first, particularly if they know they are going to be a solo ager. There are options out there for you, and you have to take the reins on your own life, because if you are at a point where guardianship is on the table, that means that if you have nobody willing to step into that role, that it will be a court-appointed person. And it's essentially having your rights removed in the sense that somebody else will make the decisions for you, from a very limited basis to absolute control over where you live, the medical care you receive, what happens with your money. And so leaving that to chance is not a viable option for people who are aging independently. So guardianship, like I said, should be the last resort, and proper planning should be the first course of action.
And I would defer to my ARP Florida colleagues, but I know ARP Florida has also done work in this area in terms of advocacy at the state level as well.
Kathy, this one's for you. We've touched on this a little bit, but what can regular folks do to influence their state and national legislators on caregiving support?
Well, this is a really good time of year to be talking to policymakers that are running for office, because they're going to knock on your door, they're going to call you, and it's very important for you to understand their voting record, where they've stood. AARP I believe you all put out a good summary of voting records on bills, and did they support the Raise Caregivers Act? I think you can go and look that up. But they're, calling their offices, sending emails. You need to be in contact with your elected officials. Start with the folks who represent you. I hope you know who your state representative is, who your state senator is, your member of Congress is. Your county commissioners also have a great deal to say about senior centers and how they spend certain funding streams that come from the feds. Do they support the nonprofits in the community that are supporting older neighbors and caregivers? I really encourage you to not take the fact that of your citizenship for granted. Be an engaged citizen and do that outreach. On the computer, it's easy, and if you're not handy with the computer, that's a nice way to get together with friends or really consult the AARP. And the Tampa Bay Times, you do a pretty good job also of candidate review and interviews, and I hope you'll be asking a lot of these questions this election cycle.
And share your story if you're comfortable doing so. Share your story with policymakers, because those are the stories. When they hear a story from a constituent, that resonates. After a meeting, they might care about the facts and figures, and they're important, but it's the stories and the emotional resonance that they're going to walk away with, and they're going to remember that. So that when they get asked to co-sponsor something, like any of the 4 bills I talked about, they could co-sponsor those bills. Those stories stick with them, and they remember that, and that gives them a reason to vote yes or to co-sponsor a bill and whatnot as well.
So this question, I think, almost all of you could answer, so I'll leave it up to whoever would like to tackle it. How do you navigate between guilt for not doing enough, yet avoiding resentment for what you give up to help whoever it is you're taking care of? I'm sure we've all felt that at some point in time.
I have, yes. Yeah, and it's not easy, because you're trying to balance things, because you want to help your loved one and do the best and do right, but sometimes it's frustrating, and it means that you may have to make certain sacrifices on sort of your own personal side of things, but you do it out of love. And it's also important, that self-care aspect too that was talked about by some of the other panelists here, and taking time for yourself and knowing when you need to take a break and step back and say, okay, I need to run an errand or watch a movie or do whatever, and just give myself a little bit of time so that I can come back more refreshed and in a better state of mind.
I'd like to jump in there. The most important thing that I tell caregivers, particularly when they call our helpline, they ask this question: when's it time for me to place my loved one? And the way that I answer it is, one, you have to be your authentic self and be honest with yourself. You need to look at 2 things: safety and comfort. One is your home still safe for you, as well as for your loved one that you're caring for? And comfort, are you comfortable in that role as a caregiver? If you're not, it's okay. At least you're being honest and saying, hey, listen, I was not cut out for this. I gave it a valid effort, but it's not for me. And that's where you can now identify the resources, because you're still going to be part of that care team. You're going to be, if you're not the immediate caregiver, you're going to be the manager of that care team. So it's important that you be your authentic self and be honest. It's okay. It's no judgment call, because hey, listen, it's like, I'll just simply share my situation with my brother. It was not something that I had planned on doing. When I had other siblings tell me, hey, that's not for me, I didn't judge them. I said, hey, listen, it's all right. that's fine. You can be that long-distance caregiver. But you got to be authentic and be true to yourself.
So this one's a natural follow-up, I think. What steps are being taken to support the mental health of caregivers? How can they access counseling or coaching to strengthen their caregiving skills?
First and foremost, go to a support group. Got to get in a support group because that's where you're going to be able to manage your emotions. It's okay to complain like, hey, listen, I had a rough time with my loved one. And you'll be surprised when other caregivers will say, you know what, they don't even have to verbalize it. They will nod in agreement with you and saying, I went through that. And so that you don't feel like you're alone. Because you should never feel like you have to deal with this by yourself. And that's why I encourage folks to go to support groups. Because as a support group facilitator, I sit in that room with my caregivers and I don't say anything. I let them do the talking. And they're getting it out and they're supporting each other. So you need to be able to manage your emotions, but also be honest about your emotions. And it's okay to say, hey, this is how I'm feeling. And it's natural.
And I would say, I completely agree. Everybody needs support. You cannot do this in a silo. You can't. But sometimes you're not going to have time to meet people in person. So find what is out there that works for you. There are a lot of online support groups. The AARP Family Caregivers group on Facebook is not a support group in the sense that it has meetings, but people can go on, they can ask questions, they can share information, they can just blow off some steam. And I call it the friendliest little corner of the internet because people there are nicer than the whole rest of the internet. And the comment sections are truly, truly helpful when someone posts. And so if you're a caregiver, if you know someone who's caregiving, I would strongly direct you to that page because you can participate at whatever level you want to. But there's not a day that goes by that I don't jump on that page and not learn something.
And I'll add that if you're interested in that ARP Family Caregiver Facebook group, facebook.com/groups/AARP Family Caregivers, all one word. You can access that link also on AARP's Family Caregiving Resource Center at aarp.org/caregiving. You can click on a link to that. You can also click on a link to another caregiving community where you can interact with fellow caregivers and ask questions. AARP also has, if you're caring for someone who's a veteran or been in the military, we also have a mental and emotional health support guide for military caregivers at aarp.org/self-care guide, all one word. And also your local area agency on aging has caregiver support programs that offer an array of services, including support groups, information and assistance, counseling, and those kinds of things as well.
Before we end here in just a few minutes, I was hoping all of you could take a few minutes to think about one piece of parting advice that you wish you could have given yourself when you first took on the role as a caregiver. So I'll give everybody a minute to think about that. And Amanda, if you don't mind, I'm going to ask you one more question here before we get to that piece of advice. This question, they're asking, their mother wants to ensure that their assets will go to family. Can she make that happen, or does the assisted living / care take precedence in that situation? I'm not totally sure.
I'm not 100% on the question, but if a person wants to make legal documents, they first need capacity to do that. So it depends on what her diagnosis is at this point and what her condition is at this point. So I would caution that. But if it is possible, then yes, I would take the reins and get it done if at all possible. And you know, there was one thing I did want to say in follow-up to the person who was asking about their adult daughter. Florida just passed a law this year, and it's a supported decision-maker law. It's somewhere between a power of attorney and a guardianship, but it lets caregivers of persons with disabilities who are adults be able to more actively care with them while they're still maintaining as much autonomy as possible. So I would recommend looking into that new law as well if you're caregiving for an adult child.
Okay. Kathy, do we want to start with you and go down the row of your one piece of advice?
I'm gonna do a little more big picture from policy making and encourage you all again to be engaged citizens. But as was pointed out here, in the coming year in the Congress, there is going to be a big discussion and debate about where we make investments and where we provide tax cuts. This is going to be a central point in this election, and we can decide as a society that people at the top and corporations continue to get large tax breaks, or we can decide that we think it is better for family caregivers, families with children, to get some of those tax breaks. And this is just, where do we want to go in the United States of America? And I'll leave that to you all to decide.
Well, my biggest takeaway that I would share with you is what I learned as a caregiver, because I'll be very honest, early on, I was a horrible caregiver. And I can say that. And the reason for that is because I was focusing on the disease versus the relationship. The moment that I pivot to focusing on the relationship and providing my brother the best medicine that money can't buy, which is love, I became a much better caregiver. And it allowed me to be in the moment with my brother. And so focus on the relationship and the time together.
I love that, Keith. Thank you. I think following on that, self-care, I'm going to stick to that because I think caretakers, again, often don't take care of themselves. You know, they're taking care of the daily duties, the weight of all the things they need to do to care for their family, their loved ones. They're often isolated in some of the struggles that they go through, so taking care of yourself sort of takes a back burner. So prioritize taking care of yourself is what I would walk away with.
Those are excellent points. I think I would add, have the conversations within your family. If there are multiple people that can potentially help out in different ways, have those conversations up front so that it doesn't all fall to one person to the extent possible. Obviously, every family is different, and relationships can be complicated, and families can be complicated, but if there are ways to help spread out the tasks, that can make it easier for everybody. Ask questions, because you don't know what you don't know, and be persistent. Because if you're advocating on behalf of your loved one, you never know sort of how it's going to turn out, and sometimes that persistence can pay off.
I will also confess that I am not always my best self when I am caregiving, because it's hard, you know, and the second time my husband was bedbound, I think I yelled, "Again?" at him, and I was in a really bad mood for about a week because we found ourselves in this really untenable situation again. So having done this so many times, one takeaway I would say is just give yourself so much grace, you know? A lot of people don't like or even love their care partner. I've been fortunate that I've loved everybody I've taken care of, and I think caregiving is the highest act of love, but it's not always easy and it's not always a pleasure. And you're going to run into some difficulties in the systems that you're dealing with, medical, insurance, legal. It's difficult. And the one thing I would say is where you see things that are going wrong, you do have to be a squeaky wheel. You do have to be persistent. Even if it's not in your nature, you have to have your voice be heard, especially if you are speaking, advocating for someone else as their care partner.
Great. Well, thank you everyone for coming tonight. Appreciate you again braving the rain and the weather outside. And thank you to our panelists. It was a great discussion.
Thank you.